Assalamu alaikum. My name is Hamza Khalid, and today the topic of discussion is disorder of sexual development in canine. A 2-year-old 15 kg dog, Australian Kelpie dog, was presented for the purpose of the gonadectomy. Phenotypically, the dog was female, having a mass protruding from the vulva. The mass was ulcerated as well as excoriated. Previously, they have used meloxicam for the treatment, but there was no improvement, and the urination of the dog was normal. Upon clinical examination, we found out 2 by 2 centimeter ulcerated mass protruding from the vulva with ossified component, most probably os clitoris. Hypoplastic penis-like structure visualized with dorsal urethral opening. A vagina was blind-ended identified on the digital examination. Moreover, sedation allowed exteriorization and detailed assessment of the genital abnormality. Further, we performed X-rays and ultrasound. On radiography, ossified structures were identified as enlarged os clitoris, and on ultrasound, both testes were located behind the kidneys. And furthermore, Wolffian and Mullerian ducts were also identified. Then we decided to go for the exploratory laparotomy. We performed midline laparotomy and we found out bilateral testes present intra-abdominal attached with the uterine remnants, but there was no cervix present. Further, the testes and the uterine remnants were removed. Gubernaculum was also not observed there, and then the routine laparotomy incision was closed. Then for the diagnosis, we performed histopathology of the tissues that we obtained from the exploratory laparotomy. The tissues was identified as the testicular mass containing the Sertoli cells, but there was no germ cell present. Epididymis without the sperms was identified, as the tubular structures present there were identified as the uterine remnants, which indicate that the persistent Mullerian ducts was present there. Then we decide to go for the karyotyping. Chromosomal analysis showed us 78XX genotype, which is a female genotype, supporting the diagnosis of XX male sex reversal in this reported case. So if we discuss the possible causes of the condition presented in this case, it might be because of the reduced 5-alpha reductase activity, which leads to the inadequate conversion of the testosterone to the dihydrotestosterone, which in return leads to the incomplete masculinizations of the external genitalia. As in this case, we have also noticed the persistence of the Mullerian duct. It could have happened because of the insufficient secretion of anti-Mullerian hormone by the Sertoli cells, or it could also be because of the failure of anti-Mullerian hormone action during the critical fetal period. In this case, we have also noticed the retention of the testes in the abdomen. That could have happened because of the inadequate release of the insulin-like growth factor from the Leydig cells, which in return leads to the poor development of the gubernaculum, which results in the abdominal retention of the testes. Possibly in this case, there would have also been reduced prostaglandin D2 signaling, which leads to impaired Sertoli cell development, and as well as testis differentiation was also impaired. So if we discuss the outcome of this case, as the mass was traumatized as a result of the protrusion from the vulva and was acting as an irritant to the dog, thus the removal was deemed necessary. A hypostatic penis that was confirmed via histological examination was removed and the urethra was transposed. As the painful protruded mass was removed from the vulva, the dog after the excision of that mass was continued with normal micturition following the surgery. And this is all about the today's case study. Thank you.